Hey everybody, welcome back to Tooth Savvy. I'm Dr. Brian Yim from York & Bay Dental Office in Hamilton. So today we're going to be talking about baby oral health. And the first tooth comes in and you're wondering, what do I do? So you go to the drugstore, to the oral care section, and you see all these products, and it's kind of overwhelming. So sometimes you'll find these little silicone finger brushes, or you'll find a longer brush with a little head on it. But for me, being a father of two, simple is better, right? So with every feed, there's going to be face cloths all around because these little guys are drool monsters, right? So what you're going to do is dampen your face cloth and wrap it around your finger. And in a seated position, you're both going to be facing forward. So that way, when baby's head wriggles away from you, the baby's head is going to rest against your shoulder or your chest. And then that way, you have more of a stable head position to be able to find the tooth and rub the tooth. So I use my free hand to pull the lip down out of the way, and I'll use my wrapped finger with the face cloth, and I'll use that to kind of work it in between the lips. And then I'll rub that lower front tooth, and then I'll turn my finger around and I'll rub the other side of the same tooth. And then by doing so, I can rub off any of the milk residue or even the food residue from their feeding. And the important thing to do there is to, when you remove the debris and the residue, you can reduce the risk of decay. And let's be honest, their breath can get a little funky too. So by doing so, they're going to have a fresher breath, but also they're going to have a lower risk for cavities, and their visits are going to the dentist are going to be a lot simpler too. So you can do this technique up until you have until you can count about 6 teeth across the front, either top or bottom. And then when they start getting their molars, then you can probably start switching to a brush. But I think as long as they have their front, up until their front 6 teeth on the top, front 6 teeth on the bottom, this finger wrapping technique and rubbing technique actually works really well. So I have a link, so click on the link down there if you want to follow along to see which tooth comes in first and which tooth comes in next. It's kind of fun as a parent too, to follow along with their development. So if you have any questions, send me a note and check it out.